Today we will be going over some basic exercises for the cervical spine. Techniques covered in this video include resisted cervical rotation, resisted cervical extension, and cervical muscle stretches for the upper traps, levator, scalenes, and sternocleidomastoid muscles. First up, we have resisted cervical rotation. We would use this to strengthen cervical spine rotators or as an at-home muscle energy technique. The patient will be positioned seated or lying down, and they will place their hand over the side of their face, taking care to not place too much pressure on their lower jaw or TMJ. Then they will attempt to turn their head while resisting with the hand. They will then hold the rotation for approximately 5 seconds and then move the head to the next point of tightness. To localize the rotation component to the AA joint, they can bring the cervical spine into max flexion and then apply resistance. As we can see here, she is doing a resisted cervical rotation for the AA joint. She's placing her hand on the side of her head, then pushing into her hand, holding for approximately 5 seconds, and then relaxing and moving to the new point of tightness. Then for this next one, this is for more of a general cervical spine, resisted rotations. So her head is in neutral, and she is pushing into her hand, holding for 5 seconds, and then moving to the new point of tightness there. Here we can see what it would look like from more of a side view. Again, she has her hand on the side of her face. She is pushing into her hand and then using her hand to rotate away and to that new point of tightness, opposite of the side that her hand was on. And then again, for the more neutral, so for the overall cervical spine, her head is in neutral and she's doing the same thing. Next up, we have resisted cervical extension, which can be used to either strengthen the cervical spine extensors or as a blocking technique for facet joints as a manual treatment supplement. The patient can be seated, and then what we're going to do is place a towel, TheraBand, or interleaked hands behind the neck and pull forward while tilting the head back. This can be used as a strengthening exercise if the towel covers the entire back of the neck and lower occiput, or as a blocking technique if the anterior force is limited to 1 or 2 segments that have restricted mobility. So as you can see, the patient is in seated, placing the towel behind her neck, and then she will pull the towel forward and tilt her head back. So she can either place the towel below one of the restricted segments to cause the segment above it to move and facilitate that extension, or if she places the towel over her neck and lower back of her head, then she can work on strengthening her cervical spine extensors. And here we can see the side view to get a better idea of how she's moving her head. Then we have an upper trap stretch. This is used to strengthen or lengthen the upper trapezius muscle. The patient can be seated, and what they will do is sit on the hand that is on the same side as the trap that needs to be stretched. Flex the head forward slightly while taking the other hand and using it to pull the head gently to the opposite shoulder, and they can hold this stretch for 30 seconds to a minute at a time. And here we can see as she goes into the stretch and holds right where she can feel that muscle burn. Then next we have the levator scap stretch for strengthening or lengthening the levator scap muscle. Same position where the patient is in seated. They're going to do a similar thing where they sit on their hand on the same side, flex the head forward slightly while taking the other hand and using it to pull the head gently to the opposite shoulder, and then rotating the head so that the nose points to the opposite armpit. And again, we will be holding this for approximately 30 seconds to 1 minute. Now we have the sternocleidomastoid stretch to lengthen that muscle. The patient again will be seated and then pretty much same position where they sit on the hand on the same side as the muscle needs to be stretched. Extend the head back slightly while taking the other hand and using it to pull the head gently to the opposite shoulder, and then rotating the head so that the chin points to the same side as the muscle that needs to be stretched. So this stretch you should feel in the front and more on the side. And finally, we have a scalene stretch. Stretch for stretching or lengthening the scalene muscles. Again, in seated, same kind of basic setup. We're going to extend the head back slightly while taking the other hand and using it to pull the head gently to the opposite shoulder, and then rotate the head back and forth to localize force to the tight musculature, holding for 30 seconds to 1 minute. So by bringing the head back, we can feel more of an anterior stretch, and then as we rotate back and forth, we can get more of a middle and posterior stretch with those scalene muscles.